Sorry about that. My dog took my spot, so I'm in a different spot now. I'm sitting on the floor. This time I'm going to talk about terms related just psychiatry and then get into medications, I think, all on this one, I hope. Psychiatry is the field of medicine that deals with disorders of the brain. I hate using the term mental disorders. It has negative connotations to it. But disorders of thought, in mood, in personality. Personality disorders, mood disorders, and thought disorders. Thought disorders would be like schizophrenia. And anxiety disorders. Don't want to forget that. That's what psychiatrists, they go to medical school, they're medical doctors, they specialize in those disorders. Some psychiatrists are now called neuropsychiatrists because we do know that it's more a neurological problem with the chemicals in your brain being fudged up. So the psychiatrist is the person you would go to who would diagnose you. They'd listen to your symptoms, look at your history, assess you, blood work, and give you a diagnosis. And then determine if or what medications you need. And generally after that, they're basically medication management specialists. And they see you when you're in the hospital. The person that you're gonna really, you usually will only see them every few months unless something's going on for about 15 minutes to cover the medication, symptoms, side effects. The person that gets down to the nitty-gritty family problems, work problems, relationship problems, how to deal with the disorder, how to work with the disorder, learn about the disorder, that's your therapist. The best treatment for bipolar disorder is a combination of a psychiatrist with the medication, a therapist with learning to deal, and you doing your part. The most common therapy is cognitive behavioral therapy, matching your thoughts and with your feelings and behavior. A tool that the psychiatrist uses to diagnose you, and a tool the insurance companies use to bill you, is the DSM. It's I think, every time they revise it, every so many years it gets a new name, new number. It's this massive book that in detail very specifically says you have to have experienced this and this and this and this to be diagnosed with this. That's all it is. Really, honestly, it's just something to make things neater and tidier so someone can glance and get a basic idea of what you're about, psychiatrically speaking. And an X where the insurance companies can mark on what to bill you and what they say is okay treatment for you. That part sucks. Anyway, drugs. The different kinds of drugs are, first of all, an antidepressant. Treats depression. It will not make you high. It is not a happy pill. It just balances out chemicals. Puts them back in order. It makes you feel normal, not high. Moods, there are many kinds. I'll do in more detail later. Mood stabilizers, many kinds. This is generally added with mania and hypomania to help bring that down. Also, to help bring depression up, balance out the moods. mood stabilizer, back to the norm. It will not make you high. It will not make you happy. It will not be the answer to all your ills. It just levels out your mood, keeps you safe. An anti-anxiety pill. Now these drugs can be addictive. They can make you high. You take them for anxiety, sometimes insomnia. Sometimes you like how they make you feel too much. Sometimes you like that they numb you. So they can be dangerous in a manner of speaking, but if you need it, you take it. I sometimes take one when my mind's going too fast and I can't slow down to get to sleep. And occasionally before certain anxiety-producing events. Occasionally very low dose. Antipsychotics. These medications are actually sometimes used as mood stabilizers too, but their main purpose is to stop the delusions, stop the voices, stop the hallucinations, put the thoughts back into an organized pattern. If you haven't experienced disorganized thoughts, it's very disturbing, and when you get them back to organized, you realize how disturbing it was. Oh, it feels so much better to be able to think in order, to be able to get out a thought, a stream of thoughts, to another person to communicate. Okay. Let's see, I have a couple minutes. ECT, electricity to the brain. Basically, just basically, it's like zapping your heart to get it to beat in the right rhythm if you have an arrhythmia. Zapping the brain to get the chemicals to, and hopefully they'll restart at the normal level of putting out and absorbing. Some people get good relief from this and some people don't sometimes, and it's usually safe for emergencies or urgent times when someone needs help now, or we've tried everything and nothing has helped. Some people have had really terrible experiences with ECT. Self-medicating. Self-medicating is you medicating yourself with something other than drugs that are meant to treat your disorder. Alcohol, methamphetamines, crack, food, gambling. You know, because you can cause your brain to release its own chemicals as a self-medicating way of dealing with a disorder. And that's it right there for those terms.